The final segment of this psychiatric tape for us is going to be a medication summary. Even though we talked about some of the medications as we went through the various kinds of problems and disorders, I would like to give us a summary and a way of putting it all into perspective. So as I began to think about how can I do this, I realized that all of your psychiatric drugs have two major side effects in common. One is central nervous system depression. And so with that, you think about drowsiness, and I think you should also think about the potential for hypotension, orthostatic hypotension, and hypotension. And the second major side effect is anticholinergic. The dry mouth, difficulty avoiding, blurred vision because of the dilated pupils. So the red, hot, dry, blind, mad. So they're warm and flushed. They got the dry secretions. They have difficulty starting the urinary stream. They have difficulty with bowel movements. The whole anticholinergic side effects. Now, in addition to these side effect 1 and side effect 2, we're going to look at the various types of drugs and look at what else is important. So if we talk about the minor tranquilizers, the anti-anxiety drugs, they have side effect 1, CNS depression, side effect 2, anticholinergic, and these are habit-forming drugs. These drugs, like Valium, are designed for short-term use only. So these can easily be abused, and if they're used for a prolonged period of time, can lead to abuse, to addiction. Now I want us to take a look at the antidepressants, and as we take a look at antidepressants, we're going to look at 2 or 3 different groups. The first one are the tricyclics. Side effect 1, CNS depression, side effect 2, anticholinergic, and remember it takes weeks for the tricyclics to be effective. So these are key elements to remember about those. And these are very similar for the SSRIs. The SSRIs are the selective serotonin reuptake inhibitors. Drugs like Zoloft, for instance, and Prozac. And they have side effect 1, CNS depression, side effect 2, anticholinergic, and it also takes weeks for these drugs to be effective. Now, if we take a look at another group of antidepressants, the monoamine oxidase inhibitors, or MAOIs. These have side effect 1 big time, and side effect 2 anticholinergic big time. And these are the ones that have problems with the food substances. As you may remember, we just talked about those a bit ago. These are patients that have trouble with foods containing tyramine or tryptophan. If they consume these foods while they are taking the MAOIs, they may develop a hypertensive crisis. So don't take these patients to a wine and cheese party. They can't drink the wine, they can't eat the cheese. Don't take them to a Chinese restaurant, they can't have the soy sauce, or a steakhouse because of the steak sauce and the Worcestershire type sauces that contain aged products. And don't give them yogurt and blue cheese because these are all aged products. The MAOIs are not used as often as other drugs because of this dietary, if you will, side effect. They also have a great many interactions with other drugs, so extremely cautious in the use of these drugs and other drugs. And the last category of these drugs I want us to look at are the major tranquilizers, or the phenothiazines, frequently used to treat conditions like schizophrenia. Sometimes they're called antipsychotics. They have side effect 1, CNS depression, big time. Side effect 2, anticholinergic, big time. And these drugs deplete dopamine. So the patients have Parkinson's symptoms, so they shuffle and they shake. To prevent that, we frequently give the patient a drug like Cogentin, which is anticholinergic. They may also have dystonic reactions where they have kind of jerky muscle type responses. They are also very sensitive to sunshine, so they might ask you the question about protecting them from sun when they're outside. They may develop a granulocytosis or a decrease in the white count and get infections easily. And if you go to give them their Thorazine and they're hot and stiff, please don't give them the Thorazine. This suggests that they might be having a neuroleptic malignant syndrome. So this is just a kind of a brief summary and a way to look at medications that I think you'll find quite effective. As you go back and restudy the information, you might note the anticholinergic side effects and the CNS depression side effects of all the drugs. Now let's just do a few questions about drugs. An adult man is being treated for depression and has been taking Elavil or amitriptyline for 3 days. His wife says to the nurse, "I don't think the medicine is doing anything for him. He is still depressed." What is the best response for the nurse to make? 1, I will observe him carefully and make a full report to the physician. 2, depression takes a while to clear. We are seeing small behavior changes. 3, the medicine takes 2 to 3 weeks to be effective. It is too soon to see behavior changes. Or 4, his doctor is pleased with his progress. Have patience. And of course, the correct answer is number 3. Tricyclics, try weeks. Let's look at another question. Chlorpromazine hydrochloride or Thorazine is prescribed for a young adult with schizophrenia. For 3 days, the Thorazine is to be administered intramuscularly. Before administering Thorazine intramuscularly to the patient, to the client, the nurse should make which of these assessments? 1, checking his blood pressure, testing his urine for glucose, testing his patellar reflexes, or checking laboratory results for his serum potassium level. And the correct answer is number 1, check his blood pressure. Thorazine, particularly given IM, can cause hypotension. Another question for us. A young woman is admitted for the first time with a diagnosis of catatonic schizophrenia and is receiving chlorpromazine or Thorazine daily. She is to go home for a weekend pass. Which instructions should be given the client about her medications? Check all that apply. This is one of those new item types on NCLEX that say check all that apply. So, should the patient use a sunscreen lotion? Yes, she has photosensitivity. Should the patient avoid or do not drink alcoholic beverages? Yes, anytime you give the central nervous system drugs, you should avoid alcohol. Is it necessary to avoid hard cheeses? No, that would be appropriate for the MAOI. Is it necessary to stay away from persons with colds and infections? Yes, because they're very prone to a granulocytosis. Is it necessary to drink plenty of orange juice? No. This is not a potassium depleting drug, so orange juice isn't particularly necessary. So you would check answers number 1, 2, and 4. Now let's do one last medication question. Thorazine is prescribed for a client. Which of the following, if observed in the client, would most suggest Thorazine toxicity? Tremors, sore tongue, rash, or hoarseness? And the answer is tremors, because those would be signs of the Parkinson or the dopamine depletion type symptoms.